Welcome back to Focus on Health. In case you're joining us right now, I'm joined by Dr. Sarita from Myra Clinic, and we're talking about male infertility. So, Dr. maybe we could pick it up from where we left. What are the signs and symptoms of male infertility, or rather, how do you tell that maybe you could be infertile?
See, it's very simple. It's when a couple is not able to conceive, and usually when they come, now males are usually reluctant to get their semen checked, and they say like, I am okay. It might be the female, but it is very easy to check males because we have to just do a semen analysis. They have to just give a masturbation sample and we can check the sperms. So that is where we find, if we do not find sperms or if the sperms are less, that is where we say that the male is infertile. Otherwise they might have a very regular life, they might not have any problems in ejaculation or even performing sexual intercourse. There might be no symptoms at all. It is the only symptom is that the partner or the female is not able to conceive.
Doctor, I know that men are shy to even maybe go for checkups. How do we encourage them and even maybe create awareness? That way they can even be able to seek help when it comes to male infertility.
See, it is since long time the onus of bearing a child has been on the females, and it is only the female who can bear a child. So usually males have it easy and they say that I am okay, I have no problems, and that's why they are very reluctant. And maybe it's our society also, in which the males are brought up, that says that it is because of the females. But why we say when they come that we should do we should always tell. I mean, when a couple comes to my clinic, I always tell, if a female comes alone, I tell her that you come with your husband, so that we can explain that it is not only the female from the female the egg comes, but the sperm comes from the male. So both contribute 50% for making the child. So we usually call them together and we try to explain to them how the baby forms, and it is male and female both who are responsible. So we try to counsel them, and then they understand. And nowadays, the males themselves are coming up by themselves that I want to get checked. So now the times are changing, but for a long time it was the females who were blamed. And why I say that it is easier to check the males, because for them it is a very non-invasive. They have to just give a semen sample. But for the female, we have to check a lot of things. We have to see whether she is ovulating. We have to check the tubes. We have to check the uterus. We have to check the hormones, fibroids, etc. There are a lot of things which need to be checked, but for male it's only the semen analysis, which is easy.
So Dr. maybe you could tell us what are the rates of male infertility as opposed to female infertility?
So nowadays we are seeing the male infertility is on the rise, and I would say it's approximately 30 to 40% of the infertility cases are because of the male problems. 50%, 60% could be because of the female problems, but 30 to 40% is still the males which are responsible because of the either low sperm counts or the abnormal sperms or no sperms at all.
Dr. when I was doing my research, I came across some terms. We have the IUI and even the IVF. Maybe you could tell us, Dr., what exactly do they mean, what do they entail, and how do they maybe even have an effect on male infertility?
Yeah, so when we do the semen analysis, as I said, if the sperm counts are on the lower side, so the normal limit as per the WHO, we say the sperm counts are normal when it is 15 million or more than 15 million. Now that's a number. So there are three important things: the number, motility, as well as morphology. So if the number is more than 15 million per ml, it's normal. The second part is motility. So there could be sperms, but if the motility is not adequate, the minimum motility required for a couple to have a normal pregnancy is 32%. In that, there are different categories. The sperms may be actively motile, or they will be very slow moving sperms, or non-motile sperms at all. So in those cases, where the sperm count is less than 15, but it's not zero, say it is between 5 to 15 million, 5 to 10 million. It means the sperms are there, but they are not adequate in number, or the number of the motile sperms are not adequate which can reach the egg. So in those cases, what we can do is we can offer them IUI, that is intrauterine insemination, which I can explain in the picture. So basically, first we need to see how a normal pregnancy forms. So a female has a uterus, the tubes and the ovaries. Every month a female will make an egg here. So once the egg is ready, it has to come out of the ovary and the tube will pick it up. So the tube, the egg enters the tube. So now once the egg is in the tube, that is when they should have intercourse, and the sperms will move up through the fallopian tubes and they'll fertilize the egg. Now if the number of sperms is not adequate, or the number of the moving sperms, the sperms which are motile, they are not adequate, or they are slow moving, they'll move up to here and then they'll die off. So to overcome this factor, we advise them to go for try IUI, that is intrauterine insemination. So we give the female some tablets and injections so that she makes 2 or 3 eggs, and once all that we can monitor on the ultrasound. When the eggs are ready, we give the trigger shot, and we know exactly in this time now the egg will be here. Then we ask the men to give the semen sample. It is washed with certain reagents so that all the dead sperms and the non-motile sperms, they are all separated, and we have the best moving sperms, and we pick them up in a small cannula, and we go inside the uterus and we release the sperms here close to the tubes so that the sperms can quickly go and fertilize the egg. So this is called IUI. So once we do the IUI all over the world, in spite of timing that now the egg is ready and we put the sperms, the results of IUI are maximum 20 to 25%. So see, we can just put them together. Now whether the sperm is going to hit the egg and fertilize, that happens inside the body. Okay, so that's IUI.
Dr. Kindly take us through the treatment of azoospermia. How do you go about the treatment methods, and even how effective are they?
So in azoospermia, we ask the person to first go for the we never, first of all, don't rely on one report. Always after 3 months we get the second report done from another lab, because there can always be human errors, there can be mix-ups, and it is a big shock for a person if we tell them that there are no sperms at all. So we always confirm it after 3 months from the other lab. 2 sperm counts showing azoospermia, then only we tell the person that you don't have any sperms. And in azoospermia, again we ask for the hormonal test to establish whether it is obstructive or non-obstructive. It is because of the low hormonal levels, then they can be given antioxidants or they can be given some injections, and we can try, but it's a very long process to get the sperms. If it is a testicular failure, that from birth nothing can be done, then they have to go for a donor sample. But if it is because of obstruction, then we can try to surgically get the sperms by TISA or PISA or MESA. There are different methods, and then those sperms can be used in the lab to fertilize the egg.
Interesting, Dr. And do we even have supplements that actually boost male fertility?
Yeah, as I said, if the sperm counts are low, like there are 1 million, 2 million, 3 million sperm counts, in those cases we can put the patients on tablets known as clomiphene. We can put them on antioxidants, we can put them on CoQ enzyme. So there are different kind of like vitamins available which can boost the sperm counts, but it's not 100%. For some people it works, for some people it doesn't work.
So Dr. Even as you wind up, maybe you could get your parting shot, and maybe you could even tell us whether infertility has a cure in the long run.
Yeah, of course. Nowadays, the technology has advanced so much. We have so many things available. One should not give up very soon. Even if you get a report like there are no sperms, there could be many reasons. We have already talked about them. And there are a lot of things available which we can do, and the technology has advanced. Sometimes it is curable with the medicines, sometimes we have to advise them some lifestyle changes, and then there are treatments like IVF, ICSI, TISA, which we are doing now, which are available in your Nairobi, and I think a lot of couples can fulfill their dream of having a child. It is curable.
Thank you so much, Dr. Ari, for your time. It's been quite an interactive session. We've enjoyed it, and I'm also sure that it will come actually handy to our viewers when it comes to male infertility, and also during this month, which is the Men Health Month. So that is the end of our show today. Thank you so much for tuning in, and thank you so much for your feedback on our social media platforms at KUTV Focus on Health on Facebook, and also on YouTube, and Health Focus on Instagram. We've surely learnt a lot. Who would have thought that a laptop can actually cause male infertility? But now we know, thanks to Dr. Sarita. I've been your host, Bori Michelle. Until next time, stay safe and stay healthy. I will leave you with the Health You segment. The common symptoms of male infertility include problems with sexual function, for example, difficulty with ejaculation or small volumes of fluid ejaculated, reduced sexual desire, or difficulty maintaining an erection, that is erectile dysfunction, pain, swelling, or a lump in the testicle area, recurrent respiratory infections, inability to smell, abnormal breast growth also known as gynecomastia, decreased facial or body hair or other signs of a chromosomal or hormonal abnormality, a lower than normal sperm count, fewer than 15 million sperm per milliliter of semen, or a total sperm count of less than 39 million per ejaculate. See a doctor if you have been unable to conceive a child after a year of regular unprotected intercourse, or sooner if you have had any of the following: erection or ejaculation problems, low sex drive or other problems with sexual function, pain, discomfort, a lump or swelling in the testicle area, a history of testicle, prostate or sexual problems, a growing testicle, penis or scrotum surgery, and a partner over age 35.
Focus on Health, your weekly dose of health and wealth information on KUTV.